Hey, it's me, Dr. Daniel, and in this video, we're going to be talking about neck pain and why it happens. Cervical spine is a remarkable construct of interconnected vertebrae, joints, muscles, ligaments, and tendons, all of which connect together to provide support while allowing for a wide range of motion. However, any of these anatomical structures can wear down or become injured, causing neck pain and possibly pain that radiates down the arm. Acute neck pain usually involves a tear to a muscle or ligament in the neck. Now, the neck may become sore or stiff. If muscle spasm is involved, pain may actually be more intense. Neck pain that lasts or keeps coming back over a period of at least 3 months is considered chronic. Common sources of chronic neck pain include facet joints and intervertebral discs in the lower cervical spine. The discs help to provide spacing and cushioning between adjacent vertebral bones, while the facet joints allow for limited movements and restriction of that range of motion. A disc can become a source of pain if it degenerates or if it herniates. A facet joint can become a source of pain if its protective cartilage starts to wear down or the joint capsule actually gets a tear. And now this joint degeneration begins to destabilize the joint and of course increases inflammation and stiffness. These degenerative changes to the discs and the facet joints in the cervical spine can cause a nerve root to become compressed, which can then result in cervical radiculopathy symptoms, which is basically pain, numbness, shooting, tingling sensations down your arm. Similarly, degenerative changes to the discs and the facet joints can also cause the spinal cord to become compressed, resulting in myelopathy, which are symptoms of severe shooting pains, weakness, and/or reduced coordination anywhere beneath the level of that spinal cord compression. If you're currently suffering from neck pain, I'd like to invite you into our office for a comprehensive spine examination. We have an excellent track record of helping people to solve their neck problems non-invasively, and we'd love to at least see if we can help.